Am I too young to have a breast reduction procedure? In trying to answer this question, I think everyone should be open and admit trying to help young women and the families of young women who find themselves with grossly disproportionately large breasts at a young age is probably the most difficult area of consultation that we encounter. Fortunately, it's relatively rare. The approach to this problem, of course, is to provide the patient and their support people, which are usually their mother and father, with as much good quality information as we can possibly provide, and to provide the patient with as much positive emotional support as we can muster for them. It really is a very difficult problem for a young woman to deal with, often when multiple other things are going on in their life. What I've found over the years is that oftentimes just coming along and having a consultation is very helpful. Through the consultation process, which may involve more than one meeting, oftentimes I can inform and reassure the patient and their family members that at an appropriate time in the future, there is a procedure which will be of assistance to them. And oftentimes, once we've had the consultation, the patient can understand that whilst their distress is real and the physical symptoms that they're experiencing are very real, that now's not the optimal time for them to be considering having a surgical procedure. But as long as they know that the procedure is available to them and it can be performed at the appropriate time in their lives, then often a lot of the emotional distress is diminished somewhat, and people can go about their activities more happily, knowing that their concerns will ultimately be addressed. For a very small minority of people, even after we've gone through that process, a patient and their family members feel that they are in a situation where surgery cannot be deferred to some point in the future, and it really needs to be considered. That's a very difficult situation and needs to be handled very sensitively. Okay? But from a technical point of view, if it's appropriate to proceed and have surgery, then technically that is possible, and it's no different to performing the operation in an older patient. But clearly, in most instances, our approach will be to provide that information and emotional support and to make a long-term plan so that the patient's needs can be catered for and the procedure performed at the optimal time, which most often is not at an early age.